Hey YouTube, it's Marquita, and today is Veda day number 20, and I'm here with a quick, I guess you could call it mommy update. So, as you can see from the title, surgery, question mark. So a couple of weeks ago, and I was going to just put this into Riley's 2-month vlog when I do my mommy postpartum update, but I figured that this would take a lot more time to explain, so I'm going to explain this separately, and then I'll touch on it again when I do her 2 month update next week. So after, I would say probably about like 5 weeks postpartum, I started to notice that my stomach was completely gone down. Like, you could tell the difference between this is my uterus and this is like extra skin from the baby and things that need to be tightened up. And I started to notice that there was a bulge. It's kind of hard to explain, but there was a bulge probably about this size, and then my skin was flat, and you could see this bulge sticking out of my stomach. It looked exactly like this, probably about this size as well. So the medical professional in me was like, that cannot be possibly still my uterus, because my uterus is still that big at 5 weeks, then we have a huge problem. Um, so I didn't think that it was my uterus, and my first inclination was maybe this is a hernia. So at around 6 weeks postpartum, I scheduled an appointment with my primary care physician, and went into the office, and she did an examination. And basically, I'm not going to show you guys what it looks like because it's really quite creepy looking, even to me, and I've seen some really gross stuff. But basically, what happened when she examined me is she told me to lay down flat on the table, and then she told me to like kind of do a half of a sit up. So this will be like my stomach, and this is when I'm laying down. And then when she told me to do a half of a sit up, this big bulge, like this, literally this big, raised out of my stomach. So this is my stomach, and this big bulge is there. So first of all, that creeps me out because I thought that, when I was standing up, I just thought that it was extra skin. I thought that it was extra baby fat, whatever. And then she said, well, you have diastasis recti. And I said, well, what does that mean? And she said, here, feel this. So she had me take my fingers, and while I was in this half sitting up position, she said, push down here. She said, this is one side of your abdominal wall. And then she went on this side to the other side of the bulge and said, this is the other side of your abdominal wall. Basically, your abdominal wall is completely separated and has not gone back after the birth of your child. So she basically told me that it was the equivalent. They said that they see diastasis recti in middle-aged men who drink a lot of beer, and also in pregnant women. So the next step was for me to go and get an ultrasound, and so I had an ultrasound that following week. So I was 7 weeks postpartum. So I guess like last week, maybe the week before last. Yeah. And I had an ultrasound, and it took the ultrasound technician a really long time to try to figure out what was going on. Now, I was born with an umbilical hernia, and back when I was born, apparently they were just meant to close up on their own, and there was never any talk of any surgery. So I've always had an umbilical hernia. Now, I've noticed that when in both of my pregnancies with Imani and with Riley, they were able to, while I was pregnant, I was able to feel body parts. If I put my finger into my belly button, I could feel body parts, like ridges of knuckles. I'm not just talking about like lumps. Like Riley and Imani used to both put their fists in my belly button, so you could see my belly button. You could see that there was a body part, a foot, a knee, something in my umbilical cord area. And I never questioned it. I didn't think there was anything wrong with that, weird with that. No one had ever questioned it as far as a medical professional. So I had this ultrasound done, and they said, well, you definitely have a small umbilical hernia, but it's not really that big of a deal. And you definitely have some thinning of the muscles in your stomach, and it could possibly be a hernia. So last week, after hounding my primary care physician, they said, oh, you do have a hernia, and it's really nothing to worry about. And after, of course, I consulted Dr. Google, and I was like, I called them back and I said, no, I would like to get a CAT scan or something else to further rule out that this hernia is not something bigger. Because for those of you who don't know, a hernia is basically, they're usually in the abdominal or in the torso section of your body, and depending on how big or how small they are, they can have strangulation, which is where the blood vessels strangle and they flesh dies off, organs can die off. It can be a very life-threatening emergency. And actually, Riley has an umbilical hernia, which we're keeping a very close eye on. Some of you have already asked about it in the videos, but yes, it's umbilical hernia, and it's expected to close up, and if not, then she would have to have surgery. So it could, or it may or may not be hereditary as far as the umbilical hernia. But basically, I called my doctor today, and they informed me that I'm being referred to a surgeon. Now, after I've already done all my research about what hernias, abdominal hernias, and umbilical hernias, what that means is usually the only resolve is to either A, get a tummy tuck, or B, get a procedure that's really similar to a tummy tuck where they just put mesh across where your organ, where this big lump is. They put mesh to basically pull it back and I guess tie it in there. So now I'm stuck with a dilemma. I don't have my consultation with the surgeon until the 11th. The surgeon that my doctor referred me to. So I don't really know what that conversation is going to entail, but it's looking like I'm going to have to get a tummy tuck in order to fix this. And I am not vain in the least bit. I don't know how to really explain it, but cosmetic procedures have never really been high on my list of things that I had to have or wanted to have. So I'm on the fence about this surgery and the options that I have for it. So, and before everyone comments, I know that there are exercises and other things for diastasis recti. However, mine is so severe that those exercises are not going to do anything. And actually, I've been told by my physicians to not perform any of those exercises. I also cannot do any abdominal workouts, and nothing that uses my core basically. So I can't work out still. I'm still on workout restriction until either I have the surgery or get the surgery scheduled, or I mean, because there's really nothing you can do at that point. But yeah, so that's where I am. This is like a really random vlog, but I want to give you guys an update to let you guys know that I could potentially be having surgery. If I am going to have to end up having surgery for the hernia, and consequently having to have a tummy tuck, I do want to drop another 40, 50 pounds, because who wants to get a tummy tuck in vain? You know, if my insurance is going to be covering the majority of it, I'm not going to get a tummy tuck and then have to lose all the weight. So anyway, that's neither here nor there. So I just want to give you guys a quick update. This totally was not on the Veda Day list, but I'm exhausted. So yeah. So that is Veda Day number 21, and I will see you guys tomorrow for Veda Day. No, sorry, it's Veda Day number 20. I'll see you guys tomorrow for Veda Day number 21. Thanks so much for watching.